Thank you very
Great.
much. And thank you so much for inviting me to participate in this conference. That was just an awesome talk by Dr. Bird. So first, I would like to acknowledge those who funded some of the research I'll be presenting. Thank you, NIH, and also NSF and the University of Wisconsin, and also to acknowledge some of the many people who've helped with some of the research I'll be presenting. So I want to make 4 points today. First, that simply knowing gender stereotypes, even if we don't believe them, gives rise to both overt discrimination, but also unintentional so-called implicit gender bias. The conflation of gender and status would predict just what Dr. Bird said, and Dr. Clayton's point made that health conditions unique to or more common in women would be seen as less important than conditions unique to or more common in men. 3, women in STEM, science, technology, engineering, mathematics, and medicine are more likely to study issues that affect the health of women. But gender bias may impede publication, research funding, willingness to resubmit, and attainment of leadership positions. And finally, that individuals at all levels of STEM must work hard to break their own bias habits, because as the point was made, policy alone is insufficient to overcome gender bias. So first, to the point that we all know stereotypes, even if we don't believe them. Even though we know gender doesn't exist as a simple binary, but along a much more nuanced continuum, if I just asked you off the top of your head, can you name some stereotypes about men? You would be able to name them, and you'd probably come up with stereotypes just like all the studies that have done just this have come up with over the last 40 years. And you would say stereotypically men are viewed as strong, decisive, competitive, ambitious, logical, authoritative, independent. And these are termed agentic traits and behavior. There's an assumption that they require individual human agency. Similarly, if I asked you off the top of your head to just come up with some common stereotypes about women, whether you believe them or not, like all the other studies, you would probably say, well, stereotypically women are viewed as caring, nurturing, family-oriented, emotional, supportive, nice, helpful, dependent. And these are called communal traits and behaviors. So it turns out we also know common stereotypes about different racial and ethnic groups. And this was demonstrated quite well in a study from UCLA involving a very diverse group of over 600 participants. Only 26% identified as white, 22% said they were born outside the US. And the investigators said, please don't tell us what you personally believe, but what kinds of stereotypes are you aware of? What have you seen portrayed in the movies and media? And so I'm going to list the stereotypes they found, and these can be make you uncomfortable. They can even be triggering, but this is what the data showed. So stereotypes for white people included high status, rich, intelligent, arrogant, privileged, blonde, racist, all-American, and ignorant. Stereotypes for Asian people: intelligent, bad drivers, good at math, nerdy, shy, skinny, educated, quiet, passive. And now I'm going to put up the stereotypes they found for Black and Latinx people. These are painful to read. But if you live in this society, which you all do, these stereotypes will not come as a surprise to you. You know them. You are aware of these stereotypes. So stereotypes about Black people: ghetto or unrefined, criminal, athletic, loud, gangsters, poor, unintelligent, uneducated, lazy. And stereotypes for Latinx people: poor, illegal immigrant, uneducated, family-oriented, lazy, unintelligent, loud, gangsters. So it is these stereotypes that are responsible for overt discrimination and also for implicit bias against minoritized groups. They're responsible at the institutional level for the fact that women are paid less than men. They're responsible for men being penalized for taking family leave, for the different amounts of funds, as was just pointed out in the previous 2 lectures, allocated for research to improve the health of women versus men. These stereotypes are responsible at the interpersonal level for sexual harassment, microaggressions, and decisions about who to hire, mentor, sponsor, reward, publish, and fund. And these stereotypes are internalized. They're responsible for the imposter syndrome, stereotype threat, an individual person's decision about where they fit in career decisions. Do they fit as a nurse? Do they fit as a nuclear engineer? Or within medicine, do they fit as an interventional cardiologist or as a pediatrician? And decisions about whether to resubmit after a grant or a manuscript rejection. So just as we have stereotypes about different groups of people, we also have stereotypes about different occupations and roles within those occupations. And research shows leaders are stereotyped as being competitive, self-confident, aggressive, ambitious, powerful, decisive. So where would you get a better alignment, a better fit between stereotypes about leaders and stereotypes about men or women? Clearly, there's a better alignment for stereotypes about men. In fact, this has been termed the think manager, think male phenomenon by Virginia Shine. And she's found it exists cross-culturally in the US, in Europe, in Asia. But it provides a slight advantage for men being evaluated for or evaluating in leadership positions because, they sort of look like a leader. Even though research on leadership finds that the most effective leaders lead with a transformational leadership style, which pulls from both columns. Transformational leaders may be strong, may take some risk, but they also care about members of the organization. They may even be nice and helpful. So we demonstrated this think manager, think male phenomenon in our own faculty at the University of Wisconsin by asking them to take an implicit association test, an IAT. And at this point in time, you're probably all familiar with this. This is something that was developed by Anthony Greenwald and colleagues, and it basically tests how quickly, how strong the cognitive link is between certain stereotypes and certain groups of people. And this particular test showed our faculty on their computer screens male gendered names like male or female gendered names like Ian or Jennifer, and then words associated with leader like strong, assertive, or words associated with supporter like helpful. And it turned out over 70% of our faculty more quickly matched the male names and the leader words and the female names and the supporter words, including myself. And I can promise you, if you ask our faculty, do you think there's anything about gender that would determine how effective a leader was? And their response would align with research showing that indeed gender makes no difference in the effectiveness of leaders. In fact, we are all very sad that our wonderful Chancellor Becky Blank is leaving to become president at Northwestern. Nevertheless, they have this implicit association, this think manager, think male phenomenon. Also, because we know these binary gender stereotypes, they create these sort of implicit rules about how men and women should and should not behave. And we know that men and women who break these gender rules, who behave outside these prescriptive gender norms, will suffer social penalties because we have words in the English language to describe men who are viewed as too communal, right? These are not flattering terms, words like wimpy, sissy, weak. And we also have words in our language to describe women who are viewed as too agentic, right? Again, not flattering terms. Words like bossy, domineering, abrasive. Shelley Carell from Stanford recently did a very elegant study looking at the words used in performance evaluations and thousands of performance evaluations in the tech industry, and found that there was a lot of what's called gender policing going on. So men were advised to behave in ways that more align with these agentic male gender stereotypes. They were told, be more assertive, take a leadership role, take charge. Women, on the other hand, were policed to behave more in line with these communal gender stereotypes, right? They were told, oh, don't be so abrasive, smile more, be softer, be more collaborative in your leadership style. But you can see how this can place women leaders in a very difficult situation, because if they behave in ways that they think are stereotypic for leaders, they risk violating these gender norms and suffering social penalties. But again, the good news is transformational leaders pull from both columns, and there's some research to suggest that women are more likely to lead with a transformational leadership style than are men. Okay, so it could also be that this lack of fit could work against women in grant peer review. For example, Carly and colleagues found when participants selected traits for an average man, they strongly overlapped with traits for a successful scientist, but traits for an average woman did not. And creativity and innovation, things that are highly valued in proposed research in a grant proposal, are more strongly associated with male than female gendered stereotypes. So it is possible that this lack of fit underpins the finding of Whitman and all, that when grants awarded by the Canadian government, when those grants were awarded based on review of the research being proposed, there was no gender difference in award rate. But when the awards were made on the basis of review of the scientist who was applying for the grant, women were significantly less likely to be funded. And it might also account for the fact that even though for decades the award rate for new R01s for men and women identical, but for the renewal for the type 2 R01s, women have been consistently had a lower funding rate, 2 to 8 percentage points lower than the funding rate for men. And this is what the research would predict, because here you're getting the lack of fit for women with scientist and with leader. These are the scientific leaders. But I will say that when I looked at the NIH website in preparation for this presentation, in 2020, first time since 1998, for the type 2 R01 renewals, men and women have the same award rate. So go NIH. There are dozens and dozens of experimental studies documenting that women and non-white individuals are rated lower on their performance and employment-related variables compared to men and white individuals, even when the work or application is identical. And I just want to walk you through one of these studies so you can see how this research is done. And this study is particularly interesting because the participants could be our peers. The participants here were 94 physics faculty, 157 biological science faculty at 8 US public research universities. And they were given a cover story with a hypothetical CV, either in the physics or biological sciences. And the cover story was they were looking for advice on how to tell their graduate students what would be the best way to format their CV when they're applying for postdocs. So they asked some questions about the CV formatting, but then they also asked questions about the hireability and competence of the applicant. And the applications were identical, except for one being in physics and one being in biological science, except for the names. And the names were pre-tested and documented that they did indeed signal race, ethnicity, and gender. So for the white applicant, the name was either Bradley or Claire Miller. For the Asian applicant, Zhang Wei or Wang Li. For the Black applicant, Jamal or Shanice Banks. And for the Latinx applicant, Jose or Maria Rodriguez. Otherwise, exactly the same. And so the male applicant was viewed as significantly more competent and hireable than the female. And again, this is emblematic of a large body of research across many fields that finds that women tend to be regarded as less capable and less accomplished than men, regardless of the actual level of accomplishments. And this is especially true in roles that require intellectual or physical strength because of the alignment of strength with male gendered stereotypes. And then the white and Asian applicant was viewed as more competent and hireable than the Black and Latinx applicant. And again, as you saw from those stereotypes from that UCLA study, Black and Latinx individuals are stereotyped in ways that are incongruent with academic success or intellectual prowess. And here's just a picture of the results, and this is for competence, but the graph for hireability looked just the same. So you can see the female applicant lower, the male and Latinx applicant lower, even though the applications were identical except for the name. And looking at the interaction of race and gender, for competence, there was no significant difference. For hireability, Black and Latina females and Latino males were viewed as significantly less hireable than all others, but in physics only. So go biology. And again, here's a graph showing quite a difference for the exact same CV. So you can see once these stereotypes are triggered, even objective data is distorted, is filtered through these stereotypes, even if it is unintentionally done. So there is abundant evidence affirming a lower societal value placed on women, roles predominantly occupied by women and work performed by women than men, roles predominantly occupied by men, and work performed by men. And this has deep historical roots. You could look back in the Bible, in Leviticus. The Lord told Moses a man was worth 50 shekels of silver, a woman worth 30, a boy worth 5, a girl worth 3. And those shekels of silver differential appears to remain even into modern times because Benoit and colleagues looked at Medicare relative value units, so reimbursements for 50 surgical procedures, and they matched them when they were for those performed in women, largely by female gynecologists, and in men, largely by male urologists. And 42 of those 50 surgical procedures actually reimbursed significantly higher when they were performed in men, so still worth more shekels of silver. Again, the point was made by Dr. Bird so eloquently that women have been excluded from many trials, and this continues into the modern age. It was particularly stark when you look at all of the tens of thousands of participants in the early cardiovascular prevention trials, tens of thousands of participants in publicly funded research. So, you've got the Coronary Drug Project, you've got the Lipid Research Clinic's primary prevention trial, the Harvard Physicians Health Study, Mr. Fit, no women. And also the Baltimore longitudinal study of normal human aging, no women involved for the first 20 years. This study resulted in 2 books, Normal Human Aging Volume 1 and Normal Human Aging Volume 2, without a single data point from a woman. And also, I would argue the need for this conference represents the lower societal value placed on women. And you can see, just look around you, women work at the lower echelons of all organizations. And there's a strong correlation between the percentage of women in a medical field and salary. So this is a graph from a correlation Elaine Pelley and I did looking at average salary and the percent women in various medical and surgical fields. And our statistician said this graph is the kind of graph that people who write statistics books like to put in their statistics book to show a correlation. So 64% of the variance in this model was accounted for by the percentage of women in the field. So gender bias can reduce the investment in research to improve the health of women directly, but also by impeding women's career advancement, because women physicians, scientists, and engineers are more likely than their male counterparts to study or invent things to improve the health of women, report sex differences in their research, provide and lead women's healthcare, and they also improve women's health by having better patient outcomes in several studies. So just to show you, to illustrate this with one study, so Tsujimoto and colleagues did a bibliometric analysis of over 11 million papers indexed in Web of Science or PubMed over about 40 years. And just as Dr. Bird made the point, there was some increase in reporting sex-related information, but for biomedical research, sex remains largely underreported, only 31% of the studies in 2016. And to make the point that women are more likely to study women, papers with female first and last authors had an increased probability of reporting sex. But to make the point of the lower value of women's health or research on sex or women's health, those papers, regardless of the gender of the author, that reported sex-related information were published in lower impact journals. They were seen as having lower value. So we took this one step further and wondered whether the exact same research conducted in women would be seen as being less valuable than the same research published in men. So we did a randomized controlled experiment. We invited reviewers, and we picked our sample population from R01 grantees from NIH Reporter. And we sent them a cover story saying that we were developing a new journal, the Interdisciplinary Journal of Health. And because reviewers are so busy, we were testing whether a review could be done just from an abstract alone. And we were double blinding the authors. And we said, don't worry if this isn't exactly in your area of research, because this is an interdisciplinary journal of health, and reviewers will have to be able to review all kinds of science. And then if they agreed to participate, we randomly assigned them to get one of three versions of an abstract where the research was conducted in women, men, or individuals. And they were asked to evaluate the scientific rigor of the study, its contribution to medical science, and whether they would recommend publishing the full manuscript. And it turned out research conducted in women compared to men was actually viewed as making a greater contribution to science. There was no difference in the perceived rigor of the study. But when the research was conducted in men, it was almost twice as likely to be recommended for publication, also compared to the control abstract. So either research in men was viewed as more valuable than women, or research in women was viewed as less valuable in men. But I just want to be clear. The negative performance expectations that arise from gendered stereotypes about women are not borne out by actual performance. So just to pick a few studies that show this, in a study in a large HMO, patient satisfaction scores were significantly more negative for female and non-white physicians than male and white physicians, but the quality metrics were exactly the same. In a study looking at PhD dissertations, over 1 million across all fields in the US, and looked for novel ideas by using natural language processing to look for new co-occurrences of words or phrases that had not previously appeared in science, and found that those dissertations from women and non-white men had more novel ideas, but were less likely to have an influence on science. These people were less likely to wind up with a faculty position, and the research in their dissertations was less likely to wind up being published. And finally, in a review of a grant mechanism from the Gates Foundation, Kolev and colleagues found that looking at those who were awarded the grant, women had significantly lower scores than men who got the grant. But when they followed the awardees after the grant was over, it turned out women were more likely than men to secure subsequent NIH grants and to publish their research in top journals. All right, so just to put this all together, how the lower value of women versus men and work performed by women versus work performed by men simultaneously impede the advancement of women in STEM and the improvements of women's health. Starts off with women investigators more likely to conduct research in women. And as pointed out this morning, some areas of research on diseases in women are underfunded relative to their lethality and compared to diseases in men. Then, as showed by that study from Canada and others, there may be bias against women investigators in grant peer review. Both of these may collude to account for the fact that, for example, for decades, women were less likely than men to have their R01s renewed. So then, as we showed, manuscripts describing research conducted in women are less likely to be recommended for publication. And there's also some research showing there may be bias against women authors. So taken together, women faculty will have lower research productivity and visibility in the scientific community when compared with their male colleagues. And then they will be less likely to be promoted to leadership positions in academic medicine, where they can advance women's health research, education, and clinical care. And the bottom line, as this conference is showing, is that there will be less research conducted to improve the health of women. Well, this is pretty depressing, is it not? So let's move to a more positive ending, which is that bias is indeed a habit that can be broken. And we are focusing on helping STEM faculty break the bias habit because policy alone does not change behavioral norms. And we know this as one example. We can look at pay equity. Equal pay for equal work has been the law of the land for almost 50 years, but study after study confirms gender pay inequity in academic science and medicine, including among chairs, after controlling for all conceivable confounders. We also know for organizational culture to change, the individuals who are responsible for creating that culture must intentionally change their behavior. So one of the few strategies proven effective in helping people change their behavior in response to this habitual automatic stereotype-based bias has been called motivated self-regulation of bias in social psychology, intuitive override in judicial reasoning, forward-looking tunability by reasons in philosophy, and breaking the bias habit by our research team. But any of you who've tried to break a habit or help your patients break a behavioral habit know it requires more than simply good intentions. It is a multi-step process. It requires awareness, motivation, self-efficacy, right? You have to feel confident you can engage in a new behavior and that there'll be some positive outcome. And importantly, you must deliberately practice the new behavior until it becomes habitual. So we had an opportunity with NIH funding to develop and test a bias habit reducing workshop, a 2.5-hour workshop focused on reducing gender bias. And this study involved 92 STEM departments at the University of Wisconsin, or units that function like departments, like divisions in the Department of Medicine. And we randomly allocated 46 of these departmental units to receive this 2.5-hour workshop and 46 to remain as controls. And the outcomes were online surveys conducted at baseline, 3 days after the workshop and 3 months after the workshop that essentially assessed those the stages of change on the last slide. So using mixed effects linear models, we found that at 3 days or 3 months, faculty allocated to the experimental departments were significantly more likely than faculty allocated to the control departments to be aware of their own personal biases, to be motivated and confident that they could engage in bias reducing activities and that they were doing so on a regular basis. So you might say, okay, well, this is statistically significant, but that y-axis looks pretty small. It's pretty small changes on a 7-point Likert scale. Is there any, real world significance? Is there any clinical significance, if you will? So we have another study led by Dr. Jennifer Sheridan at the University of Wisconsin, and it's called the Study of Faculty Work Life. And it's a postal survey that goes to all faculty. And we timed it so a wave went out before any department got a workshop and after all the experimental departments had received a workshop. And we pulled out the 92 participating units and found that faculty in the experimental departments, we're generally experiencing a more inclusive department climate than faculty in the control departments. They were significantly more likely to say they felt they fit in their department. They felt respected for their research and scholarship. They felt comfortable raising personal or family issues, even if it conflicted with departmental activities. So again, you might say, okay, well, this is, a little bit more believable, but this is still all self-report. These are surveys. Do you have any hard institutional outcome? So we went back and looked at hiring outcomes, patterns of new hires. And we looked at 2 years before, the blue bars, and 2 years after the study, the red bars. And so on the left, you can see the percentage of women among new hires in the experimental department essentially hit gender parity. Essentially, half the new hires were men and half were women, with no change in the control departments, which remained at 32%. And we also saw more ethnic and racial diversity among new hires in the experimental departments, and even a decrease in the control departments. So the next obvious question is, does this approach, this breaking the bias habit approach, work beyond a single institution and beyond just a focus on gender bias? So we are just at the end of a 5-year study called the Bias Reduction in Internal Medicine Study, or BRIM study. This is a cluster randomized control study of a 3-hour bias habit reducing workshop. It involves 19 departments of medicine, and the divisions within each department are randomly assigned to get the workshop early, group 1, or later, group 2, such that the later group remains waitlist controls for at least 3 months. And the outcome measures are again measured with online surveys. These are the sites participating in the BRIM study. We have pretty good geographic distribution. We have very good distribution of public and private institutions. And I'll just show you some very preliminary data because it is really just coming to a close. But just looking at a few key questions. So in response to the question, I intervene if I witness a student, resident, fellow, or colleague being treated in a biased way. And so the blue bar is the controls, the red bar are the treatment group. Baseline, no difference, but at 3 months, faculty in divisions that got this workshop are significantly more likely to say they engage in this action on a regular basis. While you might say, maybe this is just an example of social desirability or demand effect. Maybe the faculty just really like those investigators from Wisconsin, and so that they want to answer in a way that will make them happy. So to try to get around this, we pulled out faculty who were allocated to the treatment group who answered the survey but did not attend the workshop, because if there was no effect, you would expect them to look a lot more like faculty in the control divisions. But they actually look more like faculty in the experimental divisions. You can see that pink line with the arrow on it. And then in response to a couple of other key questions. So I challenge a personnel decision if I think it has been influenced by stereotypes. In terms of self-efficacy, I am confident that I can do this. Again, you can see a significant difference in the experimental group that received the workshop. Also action, I engage in this action on a regular basis. Significant difference in the responses of faculty in the experimental group that received the workshop. And again, pulling out those that did not attend, we also see that they look more like faculty who received the workshop than those that did not. So we think this approach worked because it engaged those responsible for organizational norms. It incorporated strategies that have been shown to be effective in fostering sustained intentional behavioral change. Participation was voluntary, and it enabled social diffusion of the intervention by targeting the entire department or division. So I want to leave you all with 2 strategies you can practice to break your own bias habit. These are 2 of the strategies we impart to faculty in our workshops. And the first one is to practice growth mindset statements. So at this point in time, if you're in academics, you're probably all familiar with the concept of growth mindset. It's based on about 20 years of very elegant research by Carol Dweck at Stanford. And her group has found in the realm of overcoming the influence of stereotypes, a growth mindset is very effective. It changes attitude, behavior, it changes behaviors, motivation to interact with people from another race. And so this is merely writing down some statement like the one here. With hard work, I can overcome the influence of stereotypes on my judgment and decision-making. Write down something like that. Put it on a sticky, stick it on your bathroom mirror, put it on your computer screen, recite that every day or multiple times per day. Very simple. The second strategy is to practice perceiving variability. So this is intentionally reminding yourself that every group has multiple subgroups, because the more heterogeneous you view any group as being, the more difficult it is to generalize any specific characteristic to all members of that group. So to practice perceiving variability, you will need to tune your ear. So tune your ear and listen for whenever you hear somebody say, members of some group are, any group, right? Women are, men are, Asian people are, people from NIH are, people from Wisconsin are. The next word is going to be a stereotype. So this is a perfect opportunity to practice perceiving variability. I'll give you an example of something that happened to me recently and show you how this works. Somebody said to me, women physicians want to work part-time. I said, some women physicians want to work part-time, some want to work full-time, some want to work 24/7. I also took the opportunity to remind him that some men would like to work part-time, but are forbidden from doing so by the tremendous social stigma. So, summary and conclusion. Gender stereotypes are deeply entrenched in habitual patterns of thinking and behaving in all of us. The conflation of gender and status negatively impacts the value placed on studying conditions prevalent in women and also the advancement of women in STEM. And finally, breaking the bias habit should benefit both women in STEM, and I would argue everyone in STEM, and also women's health, but it requires hard work. Thank you very much.